Good morning. The May 21 special school board meeting is called to order. Pam, roll call, please.
Mrs. Belford?
Present.
Ms. McDougall?
Present.
Mrs. Jenkins?
Present.
Mr. Susan?
Present.
And Mrs. Campbell?
Present.
Please stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sort of kind.
All right, please be reminded that school board meetings will be held in a manner consistent with other district meetings and activities. All attendees must wear a face mask covering the nose and mouth at all times when not more than 6 feet from the nearest person. Your cooperation is greatly appreciated. That is going to bring us to the adoption of the agenda. Dr. Mullins.
Good morning, Mrs. Belford and members of the board. The only item or thing on this morning's agenda is to have discussion on the mask policy, both for the 2020-21 school year and the 2021-22 school year.
What are the wishes of the board?
Move to approve.
Move to approve.
Second.
Moved by Ms. Jenkins, seconded by Ms. McDougall. Is there any discussion? Hearing none, please vote.
Oh, wait a minute. Don't we want to have a little discussion?
We're
Sorry.
discussing
We're
not the agenda.
the adoption of the agenda.
Okay, I'm sorry.
Yeah.
I just want to make sure.
Hang on. I didn't log in yet.
haven't seen anything else.
Yes,
nothing's
Ms.
happened.
Escobar is requesting a voice vote on this, so all in favor, please signify by saying aye.
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 All opposed, same sign. Motion passes 5-0. Okay. Since this is a little different as far as flow of the meeting today, Mr. Gibbs, I just want to verify with you on our agenda, we have it scheduled for the board to have discussion, but we will not be making any decisions, taking any votes until post-public comment, right?
Yes.
So we'll have discussion as a team on the items Ms. Campbell has requested. We'll then listen to our public comment, and then we'll come back and decide our path forward.
Yes, unless you want to do it the other way.
I'd like to make that motion.
I don't think we need a motion, it's the direction.
I would like to give direction to move us and our discussion before the public comment.
It's already
It
there.
already is.
So the public comment's after us.
Yes.
Yeah.
Okay. I'd like to make a
So,
motion to
yeah.
end the mask mandate now.
So-
At the end of the school year, I'd like to make the mask mandate end at the end of the school year. I'd like to make the motion now. Do I have a second?
Second.
There it is.
All right, I have a motion and a second. Any discussion?
Yes.
Can I interrupt for just one moment? Mr. Gibbs, do you,
Before the board votes, you need to take public comment.
Yes,
So-
that's what we decided to do. We were going to first discuss it and then the
Right.
public comment, and then vote.
so I just want to
Right.
clarify.
I mean, you
But we
can do
don't
the
have
motion
to.
in the second and open it up for discussion and then ask for comment.
But we
That's
don't have
fine,
to.
but you can't vote until the public has an opportunity to comment. Yeah.
Okay.
No way around that.
So what do we do with this?
So there's a motion on the floor.
Yeah, that, it's just there, just like a regular board meeting, you guys have opened it up for discussion. If you want to discuss it, you can discuss it first. If you want to open it up for public comment, you can open it up for public comment.
Let's get the public comment done.
Let's discuss it.
Mr. Susan, can you repeat what your motion is that's on the floor?
I'd like
for
to
me?
make a motion to end the mask mandate after the end of this calendar school year, before summer school.
Guys,
June 3rd.
okay, so we have a motion on the floor at the moment. Mr. Gibbs has indicated that we can open it for discussion among board members. Mr. Gibbs, does that indicate that we can't? Ms. Campbell Ms. Campbell requested the board meeting, and she had 4 things that she wanted to discuss. Are we limited to only discussing the motion that's on the floor at this point because of?
That's the pending issue. So
So,
if he wants to withdraw, you can withdraw and then open it up for the 4 points that the meeting was called for.
I'd like to notice that Campbell seconded my motion, just so you know. So we are officially moving. And
I
she is the
understand
person
she
with the
did,
4 points.
but the process is the process. So you've got a motion pending, so that's the topic of discussion by the board.
all right, so I will open for board discussion on the motion that is on the floor. Ms. Campbell?
Okay. Thank you. And this really could have gone either way. We'd have discussion and then a motion, whatever. I think a motion was coming either way. And I'm fine with Mr. Susan's doing it all at once. So just to start off the conversation, just to be clear, thank you, Mr. Susan. You actually were thinking the same thing I was as far as this school year, because a lot of people have been very concerned that we're talking about ending it before this school year, June 3rd, and that is not the topic of the discussion. And just to briefly summarize why I think we need to continue, we need to leave it alone until for the last 8 days of school now. One is a lot of the people who were waiting for the vaccine have not had the opportunity to get it and get both doses and get past their 2-week window. And so when we start next school year, we'll be in a different place. 2, we have 8 days of school left. And 3, in those 8 days of school, we have graduations, finals, further testing. I know my daughter still has another ACE test. We've got AP testing, and we just need as few disruptions as possible. So that being said, the reason why I asked for this meeting was because of the new CDC guidelines, guidance that came out last week related to mask wearing for people who were fully vaccinated. I know you guys have seen that. And pretty much it's just, almost unlimited. If you look at the little diagrams that they give, if you've been fully vaccinated, according to their definition, then you can do and go wherever without a mask. Now, I know that leaves, for some people, a great concern because we do have a population of people that have not been vaccinated, but it does create for this next school year an issue for us. If we continue to have a mandate for masks, then we are telling our staff and our students, who at that point will be fully vaccinated, no matter what the CDC said, when you're in our buildings and on our grounds, then you have to continue to wear a mask. And I don't think that that would be fair to them, especially. When we look at, we have heard from so many parents from so many different sides. The main objection that I see repeated from the side of continuing it for the next school year is that for right now, our 12 and unders, or excuse me, our under 12s have not had access to the vaccine. And so, and also they've been mentioning the CDC guidance that came out after, like they sent out the guidance and they said, oh, wait a minute, schools. And they kind of came back up, but I will read to you, and I can send these to you if you'd like me to. A few days later, on the 15th, they came out with this, which says, the CDC recommends schools to continue to use the current COVID-19 prevention strategies for the 2020-21 school year, which is this school year. Also, what has been referenced several times is the Florida chapter of the American Academy of Pediatrics, and their statement specifically says they support the continued universal use of masks and physical distancing in schools by all individual students, faculty, and staff through the end of the 2020-21 school year, which is this school year. So they have not put any statements out for next school year. I've already talked about, and I'm trying to go quickly because I don't want to belabor the point. I've mentioned before how I believe that as we move forward with the availability of do-it-yourself COVID testing kits, which you can buy still at Sam's for $19.88, that the Department of Health and the data they're keeping and their contact tracing and all of that will eventually, we're going to get back to more of the normal role that the Department of Health plays every year regarding the seasonal flus and other things that they track. Because once you can go to the store and buy your own COVID test, then the data no longer is going to make a difference. By the way, I just sent you guys about an hour ago the most recent data for Brevard County, and we are nearing the lowest levels for we are already there for our percent is positive, and we are just above the line for our cases per 100,000. Sorry, going back to my notes. I think we're all aware, but just to remind us and the listening audience, when it comes to CDC guidelines, they are guidelines. They are not rules. They are not policies. They are not mandates, and they're not laws. And they have never. No. Listen, because just listen, please. This is not your time. You'll have your time and your 3 minutes in the sunshine in just a minute. They are guidelines, and guidelines that we have followed some of, and guidelines that we have chosen some not to. Some of the ones that we have not chosen to apply are their recommendations for testing. We have never had testing in our schools as for our students to come back like many other states have. We did not adopt that. that you had to have COVID testing before you come in. We did some temperature checks, especially in extracurriculars, but we did not do that. Schools had the option, but we did not mandate temperature checks on the way in. We did not do cohorting as they defined it. We definitely did our block schedule, and I think that's been extremely helpful this year. We did not do alternating schedules where some students were on campus one day and then other students were on campus the other day. We did not maintain the 6 feet apart. Even back as far as July, people's memories are short sometimes for the people who contact us, but you remember the American Academy of Pediatrics came out last summer and said 3 to 6 feet. And knowing that it was impossible for us to keep all our classrooms at 6 feet apart, we said, okay, we're going to adopt the 3 to 6 feet as part of our reopening plan. We also did not follow CDC guidelines for athletics and extracurriculars because their priority was do whatever you can to get school started and let athletics be kind of a secondary thing. And so we have chosen, I say all that to say, we have chosen which guidelines we want to make part of our plan and which ones we have not because of the feasibility in our own schools and counties, because of our opinions and because of guidance from our staff, because our staff, I truly believe that the CDC guidance that comes out, and I don't think it's anything nefarious or political, my personal opinion, but I do believe that they have to make guidelines for such a wide variety of locations. They are a national organization that makes guidelines for little tiny towns in the rural parts of Nebraska and the super densely populated neighborhoods of Manhattan. They've got to cover all that. And so that is why we, as elected officials, take that guidance and then we make it ours according to the best needs of our community and with the support of our local health officials and our staff and the input from our community, including our parents and our teachers and our students. So all that being said, my original idea, because I wasn't sure how things were going to move with the board, was to separate it into 3 discussions. One, I'd like for us to make the decision today regarding the 2021-22 school year, and we already have that motion on the floor. I believe our parents need that decision on either side, whether they're pro-mask, anti-mask, or in the middle. They need that decision as soon as possible so they can make their decisions for next year. The second topic was our summer programs, because we have several of those, and I think that it would be, depending on how the vote, and I was thinking about having that as a separate vote. Mr. Susan is already have a motion on the floor for ending at June 3rd. We certainly will be able to allow that, I believe, to allow them to be optional, because we're not telling people you can't wear a mask. Dr. Mullins has shared with me that if that's what we do for summer school, that we have some options for parents who are concerned, maybe with our KN95 mask, and if you want to later, share more about that. My third topic was related to graduations. I have talked to Dr. Mullins, and he talked to our principals about that. I think actually, since graduations will still be considered part of this school year, June 3rd, I think we can maintain where we are, but to clarify with our schools that because our students are going to be sitting 6 feet apart on the field, because we limit the seating capacity for the graduations and their families are going to be spread out, that once they get in and they're seated in the stadium or on the field, that they can take their masks off at the graduation time, and we'll be able to work that out. So that was my third topic. And I guess the fourth, I was trying to think what was the fourth, but it was clarifying our outdoors expectations. And again, I don't think that's necessarily a vote. I think that's just really clarifying with all of our leadership. I'd like to for us to give guidance to Dr. Mullins to just review one more time with our administrators and staff that our expectation for when students are outside and they're running around and can be apart and they're not like just walking side by side with their buddies, that they can take their masks off. And that's something that we've clarified from the beginning of the year with our current mask policy. It's just not always being followed. So that is my start, Ms. Belford.
Thank you, Ms. Campbell. Any other board member wish to discuss?
Yes, I can.
Ms. McDougall?
Sure. I just want to say that I want to hold steady this school year and agree with June 3rd. Okay, we will, that's it. But I am concerned for next school year. I would like it to at least be voluntary because I want people to have the option to, but I heard it was, to me what I heard, Mr. Susan, was that it seemed kind of cut and dry, like no mask. So I just want to make sure that it can be voluntary for our students, our teachers, whoever would like to wear a mask can do it. Now, I just want to make sure that, I'm hopeful that this is going to keep going down, and more people will be vaccinated. I think we should be able to have the ability to relook at it if, let's hope not, that it should go back up again. That's all I'm saying. I just don't want anything to be all black or white. There's shades of gray. So I am in support of certainly the motion on the floor at this time.
Thank you, Ms. McDougall. Ms. Jenkins?
Yeah, I just want to say a couple of things. So despite what some people may think, weeks ago, I actually advocated to the superintendent to have this meeting sooner than later. I didn't feel like we needed to wait until June 8th. I think we kind of knew what the Department of Health would suggest and say, and our health officials, so I felt like that wasn't really necessary. So I do just want to say a couple of things. In regards to picking and choosing CDC guidelines, I am the only person on this board who didn't have the opportunity to be a part of that process. So I don't want to be put in that bucket by any means. And I am one of the people on this board who was directly impacted by those summer decisions coming into the new school year last year, working with students, being in the classroom. So I have a different perspective, but I acknowledge that. I think it's really important for us to acknowledge, too, those choices that you guys made, those important choices that you made last summer, are the reasons why our students were able to come to the brick and mortar setting, why they were able to stay in there, why they were able to have families go to work, and our economy be successful the way it is now. So I think we need to remember that. Remember that those decisions were effective and really, really important. But I also think we also need to acknowledge the fact that we had multiple staff members, even students, be hospitalized, end up in ICU. We lost a teacher who also then lost her mother. We have a staff member currently on a ventilator because of COVID. And so we need to understand that even though we're seeing a positive trend and we're all ready to be done, there are risks out there. I always follow the science. I respect the guidance of the CDC. I, as a vaccinated person, now am happy to follow the guidance, remove my mask in settings that it's allowed and it's not mandated by the private businesses. I do have some reservations, though, and the reservations I have are simply just, I feel like we're kind of predicting what might happen in August, and I understand that I understand families need to plan. I get that. But the CDC guidance is for, the vaccines are available for 12 and up. Our mask mandate was technically for children younger than that. The CDC guidance was for vaccinated people, and we have no right and no business to ask people if they're vaccinated, so we have no way to prove that. And we have no right and no business to enforce someone to take a vaccine that's experimental at this point. So my reservation personally is just, I don't feel comfortable assuming what August is going to look like. I don't feel comfortable putting potential students and their families at risk if they choose not to be vaccinated. So that's just where I'm coming from. Thanks.
Thank you, Ms. Jenkins. Mr. Susan, did you want to speak?
Yeah, I just want to say thank you. Everything that's needed to be said has already been said. The cautions have been sent out there. You have made some great points. One of the other ones that's not been put into this is the fact that our teachers and everybody else, I substituted at Melbourne, and I've been moving around, and even this morning I was moving around Suntree Elementary, and there's a lot of places where the kids are so close, they're not wearing their masks completely. So there's the CDC guidelines, and then there's a thing called common sense. And I think that we're at the point where when you look at those kind of things and you start looking at that as around what we're doing, it makes sense for me to make the motion. And I appreciate that support. The one thing that I wanted to say was, with the individuals that are here, many have not been to these meetings before, but there is an opportunity for the speakers that in the event that the individuals that are up here have already said that they're in favor of certain things, you can wave in support. We have 25 speakers. It sounds like there's a majority for one of these motions to go through. So if that sounds like something that you wanted to do, you can put your thumb up and say, I wave in support, so that we can get on to the meeting and get on to the vote. So I just wanted to kind of mention that, and I'm good. Thank you.
Thank you, Mr. Susan. Mr. Gibbs, procedural question for you. So our current reopening plan, hold on, let me separate. The current reopening plan is going to end at the end of the school year? But that doesn't impact the mask policy, right?
And you can end the mask policy at any time, so the
Ma-
board can vote to say no mandating
So,
mask.
guys, let us get the work done, okay? We appreciate your enthusiasm, but let us get the work done. So the reason I'm asking is I'm questioning if we need a motion to make changes to the summer program and the graduation because our reopening plans would not be in place, but I'm hearing from you that the policy is separate from that, and so we would in fact need that motion on those issues, right?
The board has to approve the mask implementation, and the board can take the implementation off at any time. So as
Okay.
soon as the board votes to take it off, it would be off.
Okay. My second question for you is something that Ms. McDougall brought up, and that is, if we vote today, and heaven forbid, we get to July, and we have an enormous spike in cases like we've seen in other countries, is there anything that prohibits us from re-implementing, and we're not even discussing here today, the rest of the reopening plan, right? Like all of our current restrictions that are in place as part of the reopening plan are going to end at the end of this school year, or
Right,
the end of this year.
right.
So is there anything that prohibits us from, in the future, putting forward a plan to respond to a significant change in the situation?
No.
Okay. So I ask those questions because, Ms. Jenkins, I absolutely understand what you're saying about predicting what's going to be happening in August. And I just want to make sure that we're all aware that we have the opportunity to respond appropriately in the event that that becomes the situation. And I think it's also important to point out there is no scenario where everyone leaves this meeting today feeling good about what the decision is, right? And I get that. I see all sides of it. I see the sides of the children who are struggling with wearing masks. I see, our teachers who struggle with wearing masks. I also see the sides of the many parents that we've heard from that have immunocompromised children that they are concerned to send to school, or perhaps they have one immunocompromised child who can be on hospital homebound, but there's concern for sending the others. I want to recognize the concern for situations like our supported level classrooms where we have medically fragile children. And my hope is that we can continue to work together in those situations to ensure the safety of those individuals who are going to be most vulnerable still going forward. Because we don't have, as has been said, vaccines for 12 and under. And there are many people who, even if they received the vaccine, still are not going to be protected, even if they can get it. I have a family member who has received the vaccine, but the likelihood of the vaccine being effective for that individual is significantly lower than the general population. So I see the full spectrum. And I want to recognize that and honor that, and just make a pledge that we as an organization will work with those families in those situations to ensure that we still have a safe opportunity for children to get a good quality education. And Dr. Mullins, I know we had talked briefly, but we've ensured that we have significant N95 masks available for any faculty, staff, or students who feel they need to continue to wear them for their own personal safety. And there's not going to be anything that's going to prohibit anyone from wearing those masks for their safety, correct?
Correct.
Okay,
Yes, that's correct.
okay. So those are, I just want to make sure that we acknowledge that this is not, there is no win-win here, right? Regardless of what the outcome of today is, there are going to be people who are going to be negatively impacted. And so I just want to let our public know that we acknowledge that. And I will say with regard to the choosing of the CDC guidelines, one element, and Ms. Campbell, I absolutely agree with you as we've gone through this process together. But I think there's one part that we left out, and that is direction from the state. And I think that it is also important to acknowledge that our state Department of Education has, they, quite frankly, were the reason that sports went forward against CDC guidelines, because the governor leveraged FHSAA to say that sports should reconvene, and the governor made it very clear that he wanted sports to reconvene. Right or wrong, that was the scenario. We also have another scenario where our Commissioner of Education has come out and said that they expect that we will make masks voluntary in the fall in school. And I think we have to acknowledge that as well as we are making these difficult decisions. And I'll be quite frank in stating that the state has been known to be, I will say, somewhat retaliatory when we don't follow the guidance that they put forward. And I'd be lying if I didn't say that that was a consideration in how I'm going to move forward today. So I think if we're discussing it, we need to look at all aspects of it. So with that, I will go ahead and.
Can I just ask one question real quick? Dr. Mullins, you and I had a discussion, and I think it's important before moving forward, but our Brevard virtual school options. I know there was a concern in the community, so we have students that are e-learning right now. We don't have an e-learning option next year. We would love these students, if they do not feel safe coming back to brick and mortar, staying within our Brevard County community. There was a concern, though, that there was some mandatory attendance issues. And so I had proposed to Dr. Mullins if we can somehow look into a consideration to where those are not mandatory anymore, because we no longer have that e-learning option for those students and their families, should masks be removed.
I had the same conversation with them yesterday. I think we all have.
Yes, thank you, Mrs. Jenkins. And I wanted to take the opportunity, if the board moves in the direction that is being suggested, that our Brevard virtual platform, we've made some significant improvements and enhancements to Brevard Virtual School from a year ago. Better understanding today what the needs are, what the impacts are, what the demand is for Brevard Virtual School. It grew by multiple 100% of participation in a very short period of time. And we have increased and sustained staffing in our Brevard Virtual program. We are prepared to be very accommodating to families as they have individual needs, to ensure that we can provide them the outstanding educational opportunities and platform that we know we can provide and deliver to our students. So just to validate your question or your interest, Mrs. Jenkins, yes, we're working with Brevard Virtual to not only be responsive, but to be accommodating to families to the very best we can, while meeting our statutory requirements, of course, but also meeting the needs of our kids and the families that come to us, depending on some of the changes that could be occurring in the near future.
So can I just ask, I know that it's something we have to work on, and I know that there are statutory requirements for testing and stuff probably for them to be in person to take those. But again, should this go forward where masks are removed, can we work on that super fast and make it very, very clear so that all of our families who may want to choose that option know whether or not they're going to be mandated to come in and what exactly they have to be mandated to come in for?
Yes, we'll get with Heather Price, our principal of Brevard Virtual School, and see where they are in the process and make sure our community understands clearly here in the very near future. We're actually on the brink of launching an updated website for Brevard Virtual School. We'll make sure that it's clearly articulated there as well, and that mandates are presented appropriately on, or non-mandates are represented appropriately on our website.
Is there any additional discussion by board members at this point in time? All right, per our requirements, I'm going to now open it up to public comment. We do have an interesting situation today in that we have had a request for ADA accommodation for an individual who cannot attend in person. Mr. Gibbs has verified that situation, and so Mr. Gibbs, I will at this point turn it over to you on that.
All right, thank you. Yes, we did receive an ADA accommodation request, and she provided medical documentation establishing she is physically unable to attend today. So she provided a statement that she asked if we would read in her stead, so we agreed to do so. The public speaker is Nicole Miles, and I will read her statement verbatim. Good evening to our incredible board members, BPS staff, teachers, and fellow parents. I would first like to thank the board for handling such a challenging time with grace and dignity, and I'm very grateful for the emphasis you have placed on following legitimate science and experts in your decision making. I am not writing to rehash the overwhelming support for peer-reviewed virology, infectious disease, public health, and epidemiological science in favor of maintaining stringent COVID mitigation measures, such as mask mandates. I know you, in the majority, support these measures and see through the pseudoscience, false analogies, and contorted constitutional arguments. I am writing to ask one simple thing. Please follow all CDC guidance. We are fortunate to have world-renowned experts advising us in the U.S. These experts are there to make decisions so that you don't have to. With one simple statement, we will follow CDC guidelines. You can leave it up to the experts and neutralize the debate. I understand that there are other factors, including significant pressure at play here in the state of Florida. However, I ask you to be the example that Florida and our children need, that we as a district will not be bullied into making decisions that compromise the health and safety of our children, staff, teachers, and community. Simply following the CDC guidance carefully drafted by national experts with decades of experience in public health relieves you, our board, from making decisions outside your area of expertise, and it protects our kids. Thank you very much for your time this evening, and thank you for continuing to set the standard for excellence in our state. Nicole Miles.
Thank you, Mr. Gibbs. All right, we are now at public comments. If we have more speakers than seating inside the boardroom, additional speakers may be waiting outside and escorted in at the appropriate time. Speakers are required to wear a face mask covering the nose and mouth. Hand sanitizer and sanitizing wipes are provided at the microphones. Each speaker is limited to 3 minutes. We have a clock in front of me to help you keep track of your time. When your time is over, you will be asked to stop and allow the next speaker his or her turn. Reasonable decorum is expected at all times, and your statement should be directed to the board chair. As chair, I may interrupt, warn, or terminate a participant's statement when time is up. It's personally directed, abusive, obscene, or irrelevant. Should an individual not observe proper etiquette at the microphone or in the audience, I may request the individual leave the meeting. Let's all encourage an environment appropriate for our children who may be present or watching from home. We'll start with our next 3 speakers. And as Mr. Susan indicated, if you do not feel the need to move forward with your public comment, you can just wave it off, and we'll move through the list, okay? So next 3 will be Kenneth Ludwa, Aaron Davison, and Elliot Davison. Kenneth? Ms. Church is coming to assist. Thank you, ma'am.
All right, I had some great prepared remarks, and points were made on both sides of the issue by the board that actually you stole a lot of my thunder. As Board Member Campbell indicated, the Florida chapter of the American Academy of Pediatrics recommends masks until kids can be vaccinated. However, unfortunately, all indications are that kids less than 12 years old will not be eligible for the vaccine until September, and that's after the school year starts. We also recommend that not everyone will choose to vaccinate their kids, but many will. And so what we're imploring the board is to keep the kids protected until they can be vaccinated, and until that vaccine becomes effective, as you said, Board Member Campbell, a few weeks after they get their shots. The masks are effective, but they have to be universal. And this is not just a political statement or a conspiracy theory, or even just the opinion of the much maligned CDC. It is the consensus of multiple professional public health, and medical organizations, including the American Academy of Pediatrics, the American Medical Association, the Association of Family Physicians, the Association of School Nurses, the Asthma and Allergy Foundation of America, and the American Lung Association. Ideally, Brevard schools would follow the prevailing medical and public health advice until COVID is no longer a threat. And we acknowledge the passionate arguments on the other side of the issue as well. And we acknowledge the incredible political pressure that you face. Board Member Belford, as you indicated, there's probably going to be a decision that not everybody's going to be happy with. And what we're asking for is maybe middle ground here. Let the kids get vaccinated. Let them get shots in their arms and get those vaccines effective for those of us who choose to vaccinate our kids. And then relax the mandate. That's a possible middle ground here that we're asking for. So again, that's what we're asking for, and thank you for your attention.
Thank you, Kenneth. Aaron Davison?
Hello. I'm Erin Davison. First of all, thank you for having this meeting and for your willingness to discuss masks. I homeschool 3 of my 4 children, 2 specifically because of your current COVID policy. My daughter, who's here and speaking next, has had the privilege of attending school this year with a medical excuse for masks. Although this has allowed her to breathe freely, it hasn't been without harassment from both students and a teacher. Standing up for her health and her rights has made her a target. If any of you have kids or are around children at all, you know exactly what's going on. Kids aren't wearing masks. They play team sports in close contact with one another. They go to church, groups, and activities. They're running in and out of their friends' houses and having sleepovers. And then for some reason, they wear masks at school. What's the point? Close contact quarantines are doing the same thing. They essentially get 10 days of excused absences from school and continue the rest of their life as normal. I know that isn't your intention, but that is exactly what is happening. This whole year, you have based your decisions on CDC and DOH recommendations, despite many people wanting something different. As you know, those organizations have now changed their recommendations, and we are still fighting for our rights to make individual decisions. We're on the same page. It's time for change. Florida's own education commissioner has spoken out against kids wearing masks in school. Our governor has ended the state of emergency. The Brevard County Sheriff's Office doesn't require a mask. I could walk into the government building across the street mask-free with 0 questions asked. Our school board is lagging behind. Your indecisiveness is doing a disservice to the children in this county. It's time to remove the mask mandate. It's time for the harassment of our children to end, and it's time to let them breathe. This past Wednesday, I listened to an NPR interview with Quentin Lucas, the mayor of Kansas City, Missouri. Because of his personal views, he initially resisted the new CDC guidelines and said his city would remain wearing masks. Within hours of this decision, he changed his stance and completely removed the mask order for his city with no vaccine strings attached. Why, you might ask? Because he decided to put his personal beliefs aside and listen to the CDC and the people of his city. He actually heard from people with differing viewpoints and then reasoned logically. It's time for you, our elected officials, to be brave leaders like Mr. Lucas has been. Follow his example and listen to the people. It's okay to change plans regardless of how far we are into this school year. If you came into this meeting today with your personal and political beliefs being the basis for your decision regarding masks, it's okay for you to change your mind right now. When you know better, you do better. Thank you.
Thanks, Erin. Elliot Davison?
Good morning. My name is Elliot Davison, and I go to Satellite High School, and I don't think mandated masks should be a rule. Do you know how hard it is to learn when you can't hear what your teachers say in your classes? Almost everyone I know has had problems, whether headaches, earaches, or fogged up glasses. These masks are very hard to breathe through, and what do my classmates' faces look like? I couldn't tell you. They still enforce the mask rule even if you're not too close. Coughing, sneezing, then in a mask for hours, just gross. Wrestlers are on top of each other without a mask on, yet people can't face one another. What is this phenomenon? Parents can opt their children out of FSAs and vaccines. Why not a mask? Remove the superfluous rule. That is what we ask. Thank you.
Thanks, Elliot. All right, our next three speakers are Cheryl Wojciechowski, Julie Bywater, and Maren Caldwell. Cheryl?
Good morning. My name is Dr. Cheryl Wojciechowski. I'm the Chief Science Officer at a company called J.E. Austin Associates. I'm also a former biochemistry professor at Harvard University. I also have 2 kids in the Brevard County school system. Once again, I'm here in support of masking in schools for now into the 2021 school year until vaccines are available for school-aged children. According to the Scientific American and NPR, estimates for children aged 2 to 11 to be vaccinated range from September 2021 to January 22, depending on clinical trials, which are ongoing right now. As you know, everything starts on August 10th. I'm concerned that although you cited the lower numbers, COVID-19 still exists in Brevard County, and I'm most concerned because the SARS-CoV variants continue to accumulate. Florida currently has the UK, Brazilian, and South African variants with 3,510 cases of the UK variant reported as of April 5th, 2021, according to the CDC. The journal Lancet Child and Adolescent Health, published April 2021, reported that early this year, 3 times more children were admitted to the hospital in London during the first wave. The difference is that now the UK variant makes up to 70% of new infections. So children are susceptible to the variants that are circulating in Florida right now. From Nature Scientific Reports, published September 2020, both surgical masks and unvented K95 respirators, even without FIS testing, reduce the outward particle emission by 90 to 74%, respectively, on average during speaking and coughing, compared to not wearing a mask. Duke University studied the effectiveness of cotton face masks and found that they are almost as good as a surgical mask, published in Science Advances, September 2020. So, masks protect the population. It is not really feasible for the mask to be only an option. Masks must be required. The real power of masking is controlling a pandemic, is preventing the spread from an infected person to another person or several people. If an infected person is unmasked, they shed virus to their surroundings and community with every breath, word, and cough. A mask helps keep this contained. Since the virus does have several asymptomatic and pre-symptomatic presentations, and we don't know who's been vaccinated, there's no way of knowing if our kids are unnecessarily exposed to this virus. Going to school in person is important, and we can do it safely. I ask that you maintain the masking, social distancing, and enhanced cleaning mandates until all people, including children, have the opportunity to be vaccinated and build an immunity. Thank you for your time.
Thank you, Cheryl. Julie Bywater?
I just want to point out that sometimes when you guys are talking up here and you're talking towards each other, it's really hard to understand you in the back, especially when you're not facing the microphones. And so it's just a little hard for us. So thank you for taking the time to let me speak today. We do need to discuss graduations. They are before the end of the school year, as it was mentioned earlier. And while I don't have a senior this year, I had a senior last year. Let me tell you about what graduation was for him. He had lost his prom, grad bash, all those senior events. And we waited and we waited and we were grateful because we finally got a ceremony and we appreciated it. It was outside. We were all masked up. It was July in Florida. It was hot. But it was very different than what a graduation should be. It was not the ceremony we looked forward to. There were no grandparents. There was no aunts and uncles. He had 3 siblings that could not attend because we got 2 tickets. Mom and dad, that's it. None of his siblings got to see him graduate. He was masked the entire time. We were masked the entire time. When they called his name to cross the stage, we couldn't see his face. We couldn't see his smile. There were no smiles. When he looked up in the stands at his parents because he was proud he graduated, he couldn't see our smiles. Despite a distanced photographer outside, we have no official pictures of his graduation without a mask on. Nothing. You only graduate from high school once. And his pictures are masked up, every single one of them. Let me tell you, a year later, he's still bitter. Talking about graduation right now with his friends that are graduating this spring, he can't do it. He's still upset. It still hurts. We didn't order pictures because of it. You could take your masks off at Disney. Texas, Utah, Iowa have made them all optional. Iowa's made them optional the day they signed the order. School district after school district locally have started to make masks optional. Last night and tonight, there will be football games, spring football games, and those players on the field are going to be maskless. And I guarantee you most of the stands will be maskless too, because they're outside. But you're going to make them wear a mask when they sit on that chair. And I know it was mentioned earlier that the possibility of not making them masked in that chair. But let me tell you something, as a parent, when they walk across that stage, if they have a mask on, it's heartbreaking. Not sharing that experience with your family is heartbreaking. We can't undo that. And last year we looked at it and we said, hey, guess what? You know, it's okay. We have lots of things we don't know about, but this year you know better, and you have the choice today to at least make masks optional at graduation. We took everything else away from them. No prom, no grad bash, nothing. You can give them graduation. Thanks.
Julie. As Marin Caldwell is our next speaker. As Marin approaches, our next three after that will be Michelle Beavers, Joseph Chaliwa, and Tabitha Cree.
Hi, I'm Marin Caldwell, mother, former educator of BPS. I'm not going to sit up here and state statistics, CDC, any of that, because there's going to be somebody else that can dispute it. What I am going to tell you today is my experience as a mother and my children's health and how it's been affected from mask wearing. I chose to homeschool my children at the beginning of this year, but then I got them back into school, my one daughter in November and my son in January. My daughter has had a chronic cough that she has never had in her entire life that we cannot eliminate because of mask wearing. I sent her to school one day in a face shield only to be made fun of for her schoolmates to poke her face shield. My son on day one, he got in the car, he looked completely fatigued and drained. He had a splitting headache, he didn't want me to turn on the radio. He felt horrible. Day two, I picked him up, same thing, nauseous. Day three, all of those same symptoms, but extremely pale. I took him to the doctor immediately, where the doctor basically said that he was suffering from lack of oxygen. Well, you have a mask on your face. You're in a classroom. You're not allowed to take your mask off, but the teacher can walk to the front of the room and remove his mask so he can breathe. I am asking you to end this mask mandate and any policy that you have implemented within the guidelines. I don't understand how you feel that you have the right to take away our parental rights. It's not about safety when I'm going to the doctors with my children and they've now developed symptoms they never had before. That is not safety. I understand where you're coming from, but you should not have the right to take away my parental rights. And I know other people feel differently, and that is fine, but at least make it an option. Give us our parental rights back and let it be a choice. Also, what another mother has stated, our children go to church together. They go to concerts together. They go to urban air where it's wall to wall full of unmasked children. Yet we come back to school on Monday and they have a mask on their face. We are not seeing, throughout the year, I've gone to a ton of Republican Liberty Caucus events where it's 500 plus people, no mask. We're not seeing in the news that there's significant COVID outbreaks. Also, my daughter was quarantined for 10 days because she walked into the clinic where somebody tested positive for COVID that day. She had on a mask. The person that tested positive had on a mask. Why are we having a mask when you're going to send home my child for 10 days, yet her brother can attend school? And he does not get sent to, none of this is making sense. So I kindly ask that you eliminate the mask mandate immediately and any policy that you have implemented that can take away our parental rights. Thank you.
Thank you, Maren. Michelle Beavers.
Hello. I want to say that we have several counties, you're not the first that would be doing this, that would take the mask away from the children. There's several points I wanted to discuss. Number one, this is my moment in the sunshine, apparently. And my kids won't be getting vaccinated. No matter how many vaccines they have available, neither myself or my kids will be getting vaccinated. There's plenty of evidence to show that this is not good for children. It's an experimental thing. You shouldn't be pushing it and saying, well, we'll get vaccinations, it'll all be fine, because you don't know what's going to happen in the next 5 or 10 years to these kids. There's no way you can, because they're still running experiments on it. They don't know. So it doesn't matter how many shots are going to be available. That's not going to make a difference to me. My kids are homeschooling right now on Florida Virtual, not Florida Virtual, I'm sorry, e-learning with their school, because I won't mask them. I know how dangerous masks are. My husband can't wear one. The minute he does, and within 5 minutes, he can't think straight, he can't see straight, gets dizzy. My son is the same way. Now, if you want to call it genetic, call it genetic. Whatever the reason is, he sees stars if he has that mask on for more than about 30 minutes. So my kids aren't going to be masked. Now, if you don't take the masks away, they'll stay home, but we're not going to be able to e-learn, which means we're going to do our own thing, which I didn't want to do. I've never wanted to do that, but you're forcing my hand. I don't have a choice. It's 0.1%, by the way, outside. You know that, right? It's 0.1% that chance you'll get COVID from somebody else outside. That's 0.1%. That's a risk worth taking to get these kids unmasked. Let's see. My other points were, you mentioned that few distractions is possible this year because the kids needed few distractions to finish up their year. What do you think a mask is? That's the biggest distraction these kids have. Putting that on their face every day, trying to remember what they're studying because their brain gets foggy. My kids watch these children online in their class, and they see them putting their mask below their nose, playing with it, taking it off, putting it back on when the teacher looks. It's not effective because the kids aren't actually doing it the whole time. No matter what kind of teacher you have and how diligent they are, these kids are going to pull that mask down below their face. So you're going to make a lot of us go out of school, and I can't tell you how many parents have told me they're taking their kids out when you do this. So please consider what's going on. It's okay to vote to take this away. You're not going to be pioneering here, but you are going to be helping a lot of families who are concerned about next year. Thank you.
Thanks, Michelle. Joseph?
So I'm glad we're having this meeting. I wish we would have had it in May of 2020. I think we all could have been patient and understanding as parents while we learned about the virus and tried to get, and understand exactly how it was going to impact everybody. But that data came out pretty quick when it came from children. We learned very quickly that they're going to be very unlikely to spread the disease. They're very unlikely to be impacted by it. We knew that right away. And we really hoped that you would have listened. But the problem with COVID is that majority for us, it's the politics behind COVID has affected us more than the actual virus. And as elected officials, we hope that you're going to step up and weed out the politics and figure out what it is that we need for our children, because there's a big sign behind you that says every student with excellence. But the problem is that I don't see you serving it because the data said the masks affect children negatively from a social, emotional, intellectual, physical, all these things that impacts them negatively, but nobody listened. I mean, how am I supposed to stand up here for District 2 while I watched you behind the plastic prison?
Better cut them off. Don't call out one of our
Yeah.
school board members.
I didn't call out anybody.
Sir,
Keep it directed to me, please.
we've got a motion on the floor, and there's a majority support for exactly what you're saying, so I
I
understand.
can't
the-
point out that she sat behind a piece
I'm
of
I'm just
plastic.
saying that the enthusiasm is well respected, but at the same time.
This is
pointing
my
at one of our-
representative.
Sir, the rules that I
Stop
read in
the
the
clock if you're
beginning,
going to interrupt me.
the rules that I read in the beginning indicate that comments should be directed to me and about the issue and not directed to individual board members. So that is
So
very
I can't
clear in
talk
the
about
beginning.
my representative from my district?
No, you cannot.
Okay.
Would you like me to resume the clock?
Yeah, and give me more time. You just wasted 10 seconds.
That's because you opted not to follow the rules,
I
sir.
can't hear you because I'm talking and you have masks on your face.
Your clock's gone.
And you took time away from me?
We took time because you didn't respond to the directions that were provided in the directions Mr. Susan provided. I will gladly allow you to finish your 3 minutes if you are ready.
Okay, I'm ready. So I'm just gonna cut to it. Like I said, the kids are the most important thing, and we have a sign behind you that said students with excellence, treat every student with excellence. But the problem is I keep hearing, everything I hear you say has nothing to really do with the students. It always has to do with the teachers. And my problem with that is that, kids don't vote, but teachers vote. So it's easier to go out there and put on your videos with your masks on your face and virtue signal with your rainbow masks or whatever woke points you think you're trying to get this day, because that's clearly the most important thing. Is politics, virtue signaling, woke points. Let's everyone know that I'm there, I'm hip, and I'm with whatever. Even though the science says that you're destroying our kids, probably providing them with some kind of minor PTSD after this entire thing. But nobody cares because, like I said, I can't even trust that you guys as elected are even making the right decisions. Because it's not about the teachers, it's about the kids. There's only one thing that's important in this world, and that's our kids. They're innocent. You've turned them into victims. Cannot believe that I have to be up here. I mean, at the rate we're going, you're introducing this LGBTQ crap, and then, next thing we're gonna be dealing with is critical race theory, and you're gonna be forcing vaccinations on them to go back to school. You should all be
Joseph.
recalled.
We appreciate you joining us. Tabitha? Tabitha?
No. After 5 minutes.
Hello, can you hear me? All right, so I've got a couple quick points. COVID right now in Florida, all of these are Florida stats. COVID is killing an average of 60 people a week, which is awful. Complete sorry for the families. Hepatitis C, which is up, largely due to drug involvement, due to things like depression, which can be also partially linked to masks, is up even higher than that. You're more likely to die of hepatitis, more salmonella, and almost more likely to die of rabies in Florida this week than COVID. My heart goes out to the teacher in the ICU. I'm not making light of this. But you're more likely to die in a car accident than from COVID. She is hopefully, or he is hopefully, going to recover. This doesn't hit kids the same way it hits adults. We are very, very blessed that way. There are no statistics to say this hits kids worse than adults. Most of our COVID numbers, unfortunately, are the elderly. And yes, we do have elderly teachers. Fortunately, they've had the option to either be vaccinated, and now there's a growing desire for them to teach online. So they have a career path. It might not be the one they wanted, but it's not the children's fault that they're at risk. And it's not fair to children. The second part of what I wanted to talk about was a study done before there was all the hype back in 2015. We had H1N1, which was devastating to healthcare workers, especially pregnant ones. And we had H7N9, which was, again, very harsh. They wanted to try to find a way to protect pregnant healthcare workers. They took people at my gestational age and a little older, and they had them wear N95 type masks to see the effect and to see if they could make this a safe way to protect pregnant women in the workforce in the healthcare industry. We don't have stats like this on kids, and unfortunately, this is the only stats I could find, the only controlled studies done without any hype and without any motive, other than to try to protect a population.
The study is called The Respiratory Consequences of N95 Type Masks Using Pregnant Healthcare Workers, a controlled clinical study done in 2015 by Dr. Pearl Tong and colleagues. It reduced the total volume of exhaled air by the pregnant women by 23%. It lowered the minute per volume respiration of these women by 25%. Although their heart rate and O2 levels were manageable and did not seem to be significantly impacted, the volume of O2 consumed measured a 13.8% decrease. And the CO2 volume exhaled decreased by 17.7%. There was no change in the air coming to them. This was all measured on the exhale. They found that these women experienced in larger quantities than normal preterm birth and other similar complications. We don't have these stats on kids.
Thank you, Tabitha. We appreciate you being here today. All right, Matthew Dowley, Michelle Barano, and Heather Roberts. Matthew?
Hello, thank you for having me. Some objectable numbers. Florida population is approximately 16 million people. Ages 0 to 19 is approximately 4 million. Ages 20 to 65 is just over 9 million people. That's just Florida population. Florida death numbers. Ages 0 to 17, 14 people have lost their life to COVID. That is a 0.00035% death rate for the people ages 0 to 17. 11 in the same time span have lost their life to influenza, which is obviously a smaller percentage. Ages 18 to 49, which is where we get into the ages of teachers and staff, 1,373 have passed, and ages 50 to 64, 4,763 have passed, both numbers under 0.5%. 0.02 for the younger, 0.05 for the older. For Brevard population, unfortunately, I couldn't break it down by age because those statistics aren't out there. Brevard population is 601,000, almost 602,000 people. There have been 42,440 positive cases in Brevard. That is a 7.05% positive rate. The deaths of COVID in Brevard are 884.15% in our county. Moving on to the topic of masks, now that we laid the foundation of the death rate of this disease, I have with me a peer-reviewed journal that was put out through the Journal of American Medical Association, March 4th, 2020, about mask usage. It says right here, when putting on a mask, you're to wash your hands for 20 seconds. When you're wearing the mask, you're not to touch it. If you touch the mask, you're to wash your hands for 20 seconds. When you take the mask off, you're to wash your hands for 20 seconds. All of us are kind of guilty in this room of not following this right here. Me included. Go to the next page. When should a mask be used? Again, peer-reviewed journal by 2 doctors, not me. Face masks should only be used by individuals who have symptoms of respiratory infection that are coughing, sneezing, or in some cases, fever. Face masks should also be worn by healthcare workers, by individuals who are taking care of or in close contact with people who have respiratory infections or otherwise directed by a doctor. Face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there's no evidence to suggest that face masks worn by healthy individuals are effective in preventing people from becoming ill. If you do not wish to accept a peer-reviewed journal by 2 doctors, I also have with me, dated April 6, 2021, CDC's Guides to Wearing Masks, which it repeats in here that you are to wash your hands when you touch your mask, yada, yada, yada. Unfortunately, I'm out of time. I didn't even get halfway through my stuff. I think there's enough science to prove this is not a mass casualty incident. We have a very small percentage of people dying from this in our school age gap.
We
Thank you very
appreciate you
much.
joining us today. Michelle Barano, and as Michelle's approaching, I just want to remind you all of the expectation that as you are moving to and from your seats, we are asking that you wear your mask, okay? Just to make sure that everyone, there were expectations coming in, we want to make sure that we're adhering to those, okay? Whenever you're ready, ma'am.
Thank you very much. I'm the mother of an elementary school student in the Brevard Public School System. I want to thank you for this impossible job that you're trying to do right now. I cannot even imagine the stress and the worry and the anxiety that you are all going through. And I thank you for taking this on behalf of us. You're right. There is nothing you can do that's going to please everyone. No matter what decision you make here today, people are going to go home angry. People are going to be insulting you. They're going to say you didn't do your job. I just want to acknowledge that and say I really appreciate the extraordinary circumstances you find yourselves in, and I do sympathize. I hate that I have to be here talking on this subject. I hate that you have to make this decision again. I hate that anyone has to wear a mask. I know they're uncomfortable. My 11-year-old daughter doesn't like it. But this is the world we're living in. People have lost opportunities. People may get headaches from time to time. COVID is real. It is here. No matter how much we don't like it, no matter how uncomfortable we are, being pro-mask isn't being pro-COVID. I'm not rooting this virus on, hoping we have to wear these things any longer. This is a necessary preventative tactic to keep as many people safe as possible. Nothing is 100%. I don't know what the situation is going to look like on August 10th. I was glad to hear that there may be the possibility of revisiting any decision made here today. I can't see the future. I don't have a magic 8-ball that's going to give me the answer. I do know what we're going through now. These are numbers. This is from the COVID-19 dashboard from this board's website. I copied from April 30th through May 17th. This is 17 days worth of actual data in this county's schools. During the first half of this month, 132 students and 24 employees in this district reported positive COVID-19 results. I don't have information on how many were sick, how many went to the hospital, how many were asymptomatic. We just know that there were 156 positive cases in our school in 17 days. The ripple effect of these cases is 766 students who had to quarantine, an additional 390 community and household members who also had to quarantine. Because this isn't happening in a vacuum. What happens in public affects all of us. Just like, I hate to be gross, but if someone urinates in a public pool, it affects everyone in the pool, okay? This is community air, this is public, and you are responsible for protecting the public. This is with the mask mandate in 17 days. I don't know what the future holds. I don't know what the variants are going to do. We know this thing can be bad. We see it in India. We see it in the UK. I don't want to be back here in 6 months holding this up with, God forbid, deaths or ridiculously high numbers that could have been prevented with this stupid piece of cloth. That's all it is. Thank you very much. I appreciate it.
All right, Heather Roberts, Nancy McDowell, and then Megan Wright. Heather?
Hi, I am a parent and educator, and I have two scenarios. First, let's think about masks as part of the dress code. If I say it's my right as a parent to dress my child however I want, and I want to send my child to school in a bikini every day, is that going to fly? Second, my son eats peanut butter and honey sandwiches for lunch every day. It's great, it's healthy, it's filling, and he loves them. But if there's a kid in his class with a nut allergy, am I going to say, well, sorry, kid, I hope you brought your EpiPen? Or am I going to use this as an opportunity to teach my child the importance of caring about other people? He can substitute sun butter, even though he doesn't really care for it, to protect the people around him. I want him to be the kind of person who happily helps other people. What kind of society are we creating when we actively teach our children not to care about others' lives? Our children are learning by watching our actions and listening to our words, whether we want them to or not. As educators, I urge you to consider the lessons our children are walking away with. Masks may be an inconvenience, but they protect the people around you, and which is more important? Which do we want to teach our children is more important? Schools should be a safe place for everyone. Thank you.
Thank you. Nancy McDowell? Nancy? Going once, going twice? No Nancy? Megan Wright? Following Megan will be Alexia Higgins, Megan Hinkle, and Carol Varhomsky.
I read a rather interesting article that discusses the top 10 signs of a dysfunctional board of directors. It read, a dysfunctional board of directors has the ability to cause multiple headaches for your business or organization. Not only will the dysfunctional board of directors often fail to make decisions that are in the best interest of the organization, its dysfunction has the potential to move outside the confines of the boardroom, causing negative publicity. Knowing the signs of a dysfunctional board of directors will help you fix the board before larger problems occur. There are 10. Lack of confidentiality, conflicting agendas, lack of order, lack of respect, hostile environment, secret meetings, personal and political agendas, lack of trust, dominating members, and non-participants. I've attended these meetings. I've sacrificed time from my family, my commitments, to come here and speak, because I believe it's important for you guys to hear the people's opinions. I have witnessed board members stare at their phone during the public comment. I have watched a board member argue in front of an entire room of people with fellow board members because they felt attacked. I have watched this board be incapable of making decisions of their own. It is extremely disheartening to me that it takes state legislation in order to get this board to move on a matter. You guys were not elected to do an easy job. You were elected to make policies and procedures that benefit the children that are in the Brevard County school system. If it continues to operate the way that it currently is, this board is not going to get very much done. I will end with this. Your policies should not involve my child's face. Your policies should not make decisions for my child, those that are medical decisions. You don't need to wait for any kind of other entity to make this decision, and I will waive the rest of my time in support of this. Thank you.
Thanks, Megan. Alexia?
I'm going to start off pointing out that I'm a parent of an immunocompromised child. I'd like to know how many of the board members up here have an immunocompromised child that is in schools, elementary through high school at this time that they're serving. Do any of you have an immunocompromised child? I'd like to point out that as a child, as my 8-year-old said, if my 8-year-old can understand that wearing a mask is a matter of safety and protects people, it shouldn't be a matter of consideration. It's dumb to consider it, were his exact words as I walked out of the house this afternoon, leaving him to homeschool with my husband. You as a school board serve, as your mission statement says behind you, to serve every student with excellence as a standard. Not those who are healthy, but also those who have been dealt a different hand medically in life. Your job is not one in which to make a political decision-making or political posturing. Your job is to serve a very diverse population who don't always agree on this matter, but it's to serve everyone of that population. Let's remember, masking isn't hurting anyone. I have an asthmatic child who spent months in a hospital on oxygen because of an asthma attack. His pediatrician says if you remove the mask mandate in the schools, putting him in a classroom with an N95 or a cotton mask is worthless. 18 other people around him, breathing on him all day, negates him wearing a mask. A mask is being worn to protect everyone else around you and yourself. It's not, if there is no mask mandate next year, his pediatrician said that he is not allowed to go back to a classroom. There are plenty of pediatricians in this county that are irritated today that they were unable to attend because this is during business hours. They're unable to speak their voice about the impacts that this is having. And not just because people are worried that my kid can't breathe. Actually giving you medical advice of what the impacts of COVID are on children. Yes, it's a matter of inconvenience. However, removal of masks is not a matter of inconvenience for a family who has an immunocompromised child. It's a matter of life or death. I point out a couple other facts. CDC guidelines currently state that students are to mask due to multiple factors. Inability of vaccinations. Under 12 can't vaccinate. How many elementary school students do you guys serve? Ineligible to get vaccines. Let's talk vaccination rates. Less than 35% of Brevard County is currently vaccinated, well below the 70 to 80% vaccination rates needed to reach herd immunity. That means that we're not to herd immunity, and those kids who are medically fragile and can't be vaccinated because they can't have it due to medical reasons cannot rely on the support of the community around them to protect them. Thirdly, let's go ahead and bring out the fact that modifications to guidelines talk a lot about being outside. and the removal for those who are vaccinated. Enough time hasn't elapsed yet to see what the impacts of removing those masks are in the communities. August, still a long ways off. You also have at-risk populations that you need to protect and serve in the schools.
Thank you, Alexia. Megan Hinkle.
Hello, I'd like to thank you for having this meeting and allowing me to speak today. I have 2 young children of my own, and we shall fight for their rights. The new and all the CDC guidelines are discriminating, destructive, and dividing, and the CDC should be held accountable for their unscientific and foolish guidelines that have no proof. It is inhumane and a form of dictatorship to create guidelines for wearing a mask if you're vaccinated or unvaccinated, when technically COVID-19 vaccines are not FDA approved. And it is unbiblical and unconstitutional to force a vaccine on people and or bribe and to use propaganda and techniques to brainwash to thinking they must get this vaccine. Masks as well as vaccines should be optional only, please. Optional only, voluntarily. We must do what is best for our children and be role models because they tend to follow in our footsteps. Studies have been made that wearing any face covering is dangerous and ineffective against any virus. Let's take the true science here. I'll give you each copies of this Stanford scientific study. Masks restrict breathing, causing hypoxemia and hypercapnia, and increase the risk of respiratory complications and self-contamination and exacerbation of existing chronic conditions. According to the current knowledge of virus SARS-CoV-2 has a diameter of 60 nanometers, a billionth of a meter, while medical and non-medical face mask thread diameters ranges from 55 micrometers, 1/1,000,000th of a meter, which is more than 1,000 times larger. Due to the difference in sizes between SARS-CoV-2 diameters and face mask thread diameters, the virus is 1,000 times smaller. SARS-CoV can easily pass through any face mask, and children are having such a hard time breathing. I have 2 sons, and they keep pulling their mask, and I really believe they're more interested in pulling their mask instead of focusing on the teacher, and it really just should be optional for anybody, please. Thank you.
Thank you. Carol?
Hello, my name's Carol Vyhonsky. I'm a parent of a 6th grade Brevard Public School student. I want to thank you all for having this meeting now and being willing to make the decision now so that parents can have some more time to decide what they'd like to do for the next school year. I like to do my research before I come up here so that I'm giving you facts that can be verified. I've been researching school districts who have already made their decisions in Florida as far as the mask mandate for next school year go. I cannot find one. Every single one I see has voted to make masks optional for the next school year. It would be very difficult, I think, for Brevard to justify keeping the mask mandate unless you could show that we are having an explosion of cases here in Brevard to justify keeping it. We've always known from the beginning that the children are the least vulnerable population for this virus. If they get it, there's a 99.8% or more survival rate for kids. To keep these masks on 70,000 kids again for next school year just doesn't make any sense. And I support the motion that's on the table, and I ask you to vote to end the mask mandate for the next school year. Thank you.
Thank you, Carol. Madeline Sumner, followed by Catherine Delaney and Crystal Coates. Madeline Sumner.
We live in a free country, but for the last year, it hasn't looked like it.
We are being told to wear a mask, but for no reason. Masks are not free. They are not helping. Okay. They have more negative effects than benefits. I am not going to just sit here and let people tell me to wear a mask. I will fight for my freedom, my rights, and justice.
Thank you, Madeline. Catherine Delaney? Catherine?
Hi. I am here as a mom of 3 kids who go to Brevard Public Schools. And I wanted to start this off by saying Thomas Jefferson, he said that if you are willing to give up your freedom for safety and security, you will not have, nor do you deserve either. And I say that with love. I don't mean to put anybody else at risk. That's not what any of us want. But people who believe that this is impeding on our freedoms, we believe that people who want the mask mandates are directly affecting us. And it starts with a little tiny thing. It starts with a mask on your face. And then it starts with, where's your vaccine card? And then it starts with, oh, no vaccine, you can't go to school. And then it starts with, oh, you don't go to school, so you can't get a good job. So we have to fight for our freedoms. And I understand this has been a horrible year. It's been a horrible year. People have gotten sick. People have died. It is horrible. Nobody is saying that that is not happening. But what we are saying is that our freedoms are worth something. It is worth fighting for. And it starts with a yellow star on your chest. These masks are the yellow star on our chest. And I am not going to allow my children to have to deal with this any longer. My oldest is in 6th grade. She has been bullied countlessly for pulling her mask down from her nose for a second because I don't even know what. She can't breathe. My middle, who's in 3rd grade, she has had headaches. And the masks just, they can't breathe in these things. Healthy people are not supposed to be wearing these things. It says on the box that you buy this in. It does not fight against COVID-19. What are we doing here? Come on. Thank you.
Thank you. Crystal Coates, and then after Crystal, it will be Monica Dassett, Jenna Sartorio, and Grace Sumner. Crystal?
Oh, dear. Yeah.
Actually, we have 30 total, not 25. We're at 21.
Hi, good afternoon. First, I want to say thank you for calling this meeting and for making a decision whichever way you decide now so that families have time to plan what they want to do. I hadn't prepared anything formal, although I did research many facts and I typed and deleted maybe 3 or 4 speeches before coming here. I've never been to a school board meeting. I've been on PTAs and things like that. We are new to Brevard County. I have 2 small children enrolled in BPS. One is 4 years old and one is 8 years old. Technically, they have not had to wear a mask. The mandate has been optional for them, but not at their school. It's enforced on everyone. All of the 4-year-olds wear masks. Outside, doesn't matter. They all have to wear it. My children have been told every morning, if you don't want to wear the mask, you don't have to, and your teacher can call me if there's an issue. They have recently decided to stop wearing their masks, and all of the other 4-year-olds asked my son, where's your mask? Where's your mask? His teacher told him that it was okay for him not to wear the mask because I wrote to her, but it asked him not to tell any of the other children in the class. I don't agree with it. I'm blessed that my children are strong-willed enough to do what they've chosen to do, which is go maskless. My daughter complained of headaches every day. And since she stopped wearing a mask, she doesn't complain of headaches anymore. It's only been about a week, but I haven't heard it, and that's a good sign. My 4-year-old son told me every morning on the way to school, religiously, it was almost like a running joke with my daughter and I in the car, when is your belly gonna hurt? Because every day he said, my belly hurts, my belly hurts, my belly hurts, while we were pulling up to school. He's otherwise fine. He eats all day, anything you put in front of him, and his belly is fine. There's not a lot of science on mask wearing on children because no one's ever masked children before. It's not a thing. Tiny little masks are new. And in the beginning, it was okay because we didn't know what COVID was. But now we do. And we have measures that we can take to protect our at-risk population. Children with special needs can be accommodated like they always have, but not at the expense of the general population of children. Masks should be optional because parenting our kids has always been a personal choice. And I know that I can decide what's best for my family, and if everyone protected themselves, then they wouldn't be depending on society to do it for them. We need to take responsibility for ourselves, and we need to think as adults, how far are we willing to push our children to protect ourselves? Because that's what we're doing. Children are not at risk, and adults know how to take care of themselves. We should have a choice to decide for our families. That's our right as parents and as Americans. Thank you very much.
Thank you, Crystal. Monica? Monica Dassett?
Good morning. I do want to thank you again for holding this meeting. I actually really appreciated hearing about the CDC information and how you use it as a guideline for making the decisions, but I do want to comment on the moment on the sun. I don't think any of us are happy to be here. And then the sad part is some of us are going to be happy and when we leave, and some of us are not. But I find it a great privilege to be able to come and speak to you, but definitely not a moment in the sun. My name is Monica Dossett. I have a 5th grader here in Brevard Public Schools, and I'm here to ask you to remove the mask mandate, but not for my 5th grader. We have had neither a negative or a positive experience with mask wearing. You see, our family was stationed in Japan from 2018 to 2019, where we were immersed in a culture of optional mask wearing prior to SARS-CoV-2. This is not a strange activity for my family to be around. It was a personal decision to wear it or to not wear it. But I'm here to ask you to remove the mask mandate for all of the negative reasons. They do seem to outweigh the positives. You see, the youngest of our family, similar to the mom that was just speaking before me, she just turned 5. She attends a preschool here, really close in the area. It's a wonderful preschool, but they do not wear masks. But she has just turned 5 this spring, and she will be eligible to attend kindergarten this fall. And as a parent, I'm deeply concerned for her. I'm concerned for how she will properly hear her teacher. I mean, all of us adults in this room are struggling to hear you guys with your mask on. My child is going to go from an environment where she can kind of hear her teacher to another kind of hear your teacher, but it's going to be more serious. Kindergarten, and the rules have changed. So I'm worried about her education as far as academics, but I'm also worried about her just not seeing her teacher's face and how that will affect her social and emotional skills. The reason my children will or will not attend Brevard Public Schools should be a decision based on education and not health. My children's health is my responsibility, and treating each other as we're sick until we're proved healthy has just gone way too far. Parents are sharing stories of children attending Brevard Public Schools and choosing to send their kindergarten and 2nd graders without a mask, and they're being treated as they're COVID positive, and that is completely unacceptable. The governor has made it very clear that the emergency is over and our children's education is on the line, and it's time that we put education back to the top priority. Thank you.
Thank you, Monica. Jenna Sartorio. Jenna Sartorio. Going once, going twice. Grace Sumner.
We have been wearing masks for a year and 2 months now, and that has been the worst time of my life. Wait. We have been wearing masks for a year and 2 months now, and that has been the worst time of my life. When my dad tells the truth of all that's going on in the world, they think he's crazy, but he's not. He knows the truth. My dad stands for my rights.
Thank you, Grace. All right, our next three speakers are going to be Taylor Summer, Amber Cheney, and Kenneth Edwards. Taylor?
The past year, we've had to wear masks and socially distance. These masks take away our rights and our freedom. I don't understand why when I'm at lunch, we are spreading germs and we don't wear masks. But in the classroom, we're 6 feet apart and we still have to wear masks. Masks are not protecting us, they just take away our rights.
Thank you, Taylor. Amber Cheney?
Hi, thank you for having the meeting. Thank you for having it early so we can make our decisions. I'm in support of it, so I'm going to talk fast and get this over with. I just want to bring up one thing that no one else has brought up. It's really not even the policy, it's the inconsistency. Now I'm just going to tell you my story. I have a high schooler, and we're in District 2, and he wears his mask like this all day long. However, there are kids at Merritt Island for over 2 weeks who wear them like this all day long. My son is not one to buck the rules. He doesn't want to stand out. He's 14. He's not going to do something that he thinks someone is going to call him out in front of all his peers. I don't want to pull him. I'm really nervous about this being a permanent policy because I would love for you to tell me how you are going to make your policy followed. You have K through 2, you wrote the policy great. It is, how can you not understand it? So why do we have second graders getting bullied by teachers, intimidated by teachers, other kids, if your policy is written? Now, I'm gonna get into some area, and I'll talk straight to Misty, so I don't wanna name names, but I would really love some answers on that CTE video from Cocoa High, where we have a board member masked, as they should. Sorry, didn't mean to give that away. She's got 2 admin standing over her shoulder inches, breathing into her ear, unmasked. Why is my son masked all day and certain people are at Cocoa High School not wearing them?
There's no need to yell, ma'am.
I'm done.
Thanks. Have a good day. Kenneth? Kenneth Edwards. Going once for Kenneth Edwards, going twice. All right, Karen Colby, followed by Ashley Hall, and then Janice Crisp. Karen?
This doesn't do anything, guys, at Fabric. If it did anything, there would be buckets to put them in when you come and go on school property, and there's not. They're on the floor in the parking lot. Okay, I'm asking for 2 things. One involves graduation. I am a senior mom. This is my 2nd year in a row. Both my last children, that's 6 children, numbers 5 and 6 are graduating. One graduated last year in 2020, and he had nothing for graduation. It was horrible. 2021, I want to make it better. Let me describe 17 to you. That was child 4's graduation. She had a breakfast. She had a great time. They sent balloons to school. People brought cupcakes. The sports teams got to all hug and take group pictures together. Nobody heard the word mask. That was 2017. They were on the field after graduation, hugging, roses in the air. Lovely experience. Flash ahead to 2020. At the last moment, we were happily told that we could indeed have a graduation party, parades. We had a parade, and then we had the in-person graduation. 2 people could come. We have 6 children. We have had at the time, we have 3 grandparents, and I don't want to tell you how many aunt and uncles. They all got told they couldn't come because of COVID. So there we were waiting for COVID reasons that we couldn't do a good graduation for my Alex last year. Alex has not gone to college. Alex doesn't leave his room. Alex works 2 days a week and then comes back home and plays video games. That's what happened to my ACE student, varsity athlete. Okay, so we're gonna make this better for the last child, Daniel. Daniel graduates and he's got a college signing already. He's a track star as well and did well at the last track meet. Nobody was masked. None of the spectators were masked. None of the athletes were masked on the field, off the field, in the stands. They were from all over Florida. Where's the outbreak? That was 3 weeks ago. I'm begging you for graduation for my kid, number 6. Number 6 has made it through everything, everything. Spanish flu too, by the way, but number 6 has made it through it all. And I would like to have those kids able to come down onto the field with their families and take pictures like all the other kids got to. Like the kids get to probably next year. He didn't get his prom, he didn't get homecoming, he didn't get grad bash, he didn't get to have any of the spring football excitement last year for his rising senior year. He didn't get to be as big a role model as they gave him the award for being the biggest role model for. I'm very proud of my son. He was recognized by both his varsity coaches for his role model and his leadership. He gets that from his parents and from his large family. We don't wear masks. We're not getting vaccines. We will never hit that 90% number because I will make sure in my family alone, if you do the extrapolation, we will never be masked. So the school needs to look at that. Okay?
Thank you. Have a great
Thank
day.
you.
Ashley?
Okay, she got a yellow. Okay, just shut
Hello, members of the board. My name is Ashley Hall. I'm the Brevard Chair for Moms for Liberty. I do want to thank all of you for calling this meeting today. This is what we were asking for. We want to make decisions that are right for our children. I'm not going to take up too much time. You know where I stand on all of this. I would advocate for the mask mandate to be a choice. And I think that's what we've always wanted, is to be a choice. Parental rights are important, and emergencies don't take away our rights. So at the end of all of this, and when things go back to a little bit of normalcy again, you know, we're not going to forget that our rights were removed from us to make the right decision for our children in regards to wearing masks. COVID is not going away. There are plenty of other things that are here to stay: RSV, flu, bronchitis, strep throat. None of those things we've done this for. So I would just ask that in the fall, when we come back, hopefully numbers will continue to be low. Hopefully things will not go sideways. But even still, if they did, it should still be a personal choice. And I would ask that you not ever, ever mandate masks again. So thank you.
Thanks, Ashley. Janice, Chris?
Hello, thank you very much. I'm happy to be here today, and thank you for this. Thank you. My name is Janice Crisp, and I'm president of Digital Disruption Consulting Company. And I'm here on behalf of many parents of Brevard County that I've spoke to that were not able to be here today. They have repeatedly asked for the no mask mandate to be decided. And no answer has come from the board. And they've also asked for many of the policies that have been put in place to not be put in place and have had to go to the legislature to be stopped. However, concerning the mask mandate, we urge that the board follow the wishes of the parents, and I'm in favor, and they are in favor of this motion today. We remind you, you work for those who elected you, and you can and will be recalled if necessary. A point was made here today that you're here to protect the safety of the public, the health of the public. No, you're not. That's the parents' responsibility. The governor is the only person who can make mandates like you have made, this mask mandate. You are not responsible for the health of students. That is the parents' responsibility. And you have gone over and above what you were elected to do. So the governor has expressed his wishes to get back to normal. The children should not be wearing masks starting today. But I understand that what your motion is doing, and you've heard from these parents today, they want a normal graduation, they want a normal summer school. So that's up for you to decide. But we have spoke to many parents. They want these masks to be up to them. Vaccines will be up to them. Many people have said vaccines are going to happen. It's time to get your mindset that vaccines are going to be up to them. It's not will they get them, it's if they're going to get them. And you need to realize many people are not getting them. Look at the numbers. There's 18 million adults in Florida. About 5 to 6 million have got them. That's not because they can't get them, it's because they're not going to. So you need to get that through your heads. And I promise you that if we have to recall somebody, 2022 is a great time to start.
All right, the board wishes to thank our speakers that joined us this morning, and at this point, we will close public comment and revisit our motion that is currently on the floor. Is there any need for additional discussion on the existing motion?
Call the question.
Mr. Susan's called the question. All board members ready to vote?
Could we just repeat the motion?
Mr. Susan, could you repeat the motion on the
Yes,
floor?
that at the end of this school year, the mask mandate will end and become optional for students after that to include summer school this year.
Ms. Campbell? Ms. Campbell, you had seconded that motion. I just want to make sure there was some, I would appreciate it if you all would stop interrupting the business of the board, okay? Ms. Campbell, you had seconded the motion, and I think there was a slight change in verbiage on that motion. I just want to make sure that you're comfortable with your second, given the way it was presented. It was just clarification, Mr. Susan.
Yeah.
I don't think it's different. I just want to make
No,
sure
that's fine.
procedurally we're good.
Would it
Miss-
be simpler just to say after June 3rd?
Yep.
Okay.
Optional mask mandate. Yep.
Mr. Gibbs, are you comfortable with the motion as reported?
If you're changing it to optional, that would be an amendment. So if he wants to amend to say masks are optional as of after June 3rd, then that would be the amendment.
All right, so Mr. Susan, would you like to present said amendment to the original motion?
Sure, I would like to make an amendment to make it optional for next year.
Miss,
Oh, after June the 3rd.
Yes. Is that good?
Second.
Good.
so I have an amendment to the motion from Mr. Susan and a second from Ms. Campbell. Is there any additional discussion? Okay, Ms. Escobar, are you prepared for us to vote, or do you need a voice vote? All right, Ms. Escobar has requested a voice vote on this one. All in favor, please signify by saying aye.
Aye.
Aye. Any opposed, same sign.
Nay.
One nay, and the motion passes 4-1. All right. Is there any, that concludes our agenda for today. Is there any additional discussion that anyone feels that we need at this point?
Yes.
Ms. Campbell?
Okay. Yes, one real quick, if I could just take just a moment, Ms. Belford, before I go that. I would like to issue an apology because I did make a comment about Moment in the Sunshine. I do want to clarify, it was a play on words for our sunshine law, but I realize that is not something that people, it's the way we speak very regularly, but I apologize for offense if anyone was offended. You certainly are welcome here, and we heard everyone who wanted to speak. Our third point of discussion was graduation, and so just to be very clear, I'd like us to have that direction from the board. I think Dr. Mullins already
We've had that conversation, but to be super clear, when it comes to graduation, again, we're still within the June 3rd window, but because our students, I just want to see it differently from last year, while our students and our families are sitting together in a family units but spread out, and we do have reduced capacity in our stadiums from their normal full attendance, that we go ahead and make it very clear that our students and families, that when they're spread out, they're outdoors, all of that, that they can remove their mask in accordance with the policy that we actually already have in place. So that's not necessarily a motion. We don't have to take a vote because it would be, but if the board would agree that we make that, we ask Dr. Mullins to make that very clear, that would be my next request.
I think you already stated that, right? Good.
I'm with Ms. Campbell. I understand where she's going with this. It's already in accordance with our current policy. I think it's important to just reiterate so parents are aware. Our current policy, if you are socially distanced, 6 feet apart, you can take your mask off. And at graduation, all of our students, all of our families are socially distanced from each other. So there is no reason why your mask cannot come off during our graduation ceremony.
Yep.
Dr. Mullins, do you feel like you need any more clear direction from the board on that, or are you good?
And I think, I don't mean to interrupt, I'm sorry, but I think it's important because parents did bring this up. If there's some kind of direction that you want to make really clear about photo opportunities, because if they're walking across the stage in front of people, they're going to put their mask back on or whatever, providing some opportunity for those students to remove their mask for a photo if you want to figure that out somehow.
Yes, I understand the position of the board. We've already sent clarification to our principals of what the expectations are to uphold our current policy, and unless there was going to be a change dependent on today's discussion, which there hasn't, at least to this time, and that is that guests and graduates would adhere to the district policy of when socially distanced, they could remove their masks. In anticipation, our expectation is that principals are accommodating distancing for graduates so that they would not need to wear their masks while sitting on the field, and assuming they make accommodations for distancing while they approach the stage and so on. Perhaps the only anticipated time they would need to certainly wear their mask is when they come across the stage to receive their diploma. That does present a challenge for a picture of receiving the diploma when they are with the administration on stage, but often our professional photographers accommodate a subsequent picture photo opportunity. If our photographers who are contracted can make that accommodation, we'll certainly do that, and a student is social distance, can remove their mask and take advantage of a photo opportunity with their diploma cover at that time. So that has all been communicated with our principals already, but we'll make sure that they don't need any additional clarification as well.
Thank you, Dr. Mullins. So back to my original question, it doesn't sound like you need any clarification from the board, right? You're good? Okay, perfect. Is there any additional board discussion?
I have something I would like to bring up today. I wasn't going to bring it up today. I was going to wait till Tuesday, but I think it's important given some of the comments that were made. I don't know if you guys have been watching the news or reading the news, but I saw that our neighbor county, Orange County Public Schools, made a statement to the governor to protect all of our students and was speaking out on their stance on the anti-trans bill. And I think it's really important for us as an organization that says we're going to stand up for our students to make a claim as well. And so I'm asking all of you if you'd be in support of a letter as Brevard Public Schools being sent to the governor. And I think it's important to ask because then Mr. Gibbs can make that happen for us as soon as possible.
When you guys told us
Once again, we are in the middle of a business meeting. I'm going to ask you to please stop interrupting the business of the board. You are welcome to stay and listen to the discussion, but if you continue to interrupt the business of the board, you will be asked to leave, okay? Did you say something, Mr. Jenkins, or Mr. Gibbs? Okay, so Ms. Jenkins has requested a letter be drafted in support of our students. I have not had the opportunity to see anything that took place. I don't know that it necessarily matters, but my role is to facilitate, so if you all... So am I hearing that we would like an opportunity to review the issue prior to taking action?
I don't really know why we would need to review an issue it
Well,
would be a letter
because Ms.
drafted by
Jenkins,
us.
board members may want to be comfortable with what it is that we're asking for prior to, so,
Yeah,
you
I
know,
understand.
they have
I
to have
understand
their
that. I think
comfort
it's
level.
clear what we're asking for. The letter would be drafted by our public school. We wouldn't be sending the exact same letter as Orange County Public.
I understand that. But if board members would like to familiarize themselves with the issue, I think it's more than fair for them to have an opportunity to review it since it's just being brought up now. Please stop interrupting the board. For future reference, Ms. Jenkins, and I understand that you were planning on bringing it up Tuesday, but you decided to bring it up today. You can obviously send something to Mr. Gibbs and ask Mr. Gibbs to send it out to the board so we can review it prior to the meeting, just to facilitate expediting things. And that way we're not violating sunshine, but he can share that this is a potential issue of discussion coming forward, just so that we can be all on the same page. So, board members, am I hearing that you all would like more time to look at it? Do you want to take action at this point?
I don't want to take
Okay, I'm not hearing support for taking action at this point. Ms. Jenkins, if you would like to share that information with Mr. Gibbs, and if you would like to request, I can put it on for a point of discussion at the next meeting.
Yep, please do.
Super. Ms. Campbell?
Yes, just back to what I mentioned at the beginning, which was I'd like to ask Dr. Mullins to clarify again with our administrators our current mask policy when it comes to students being outdoors. Just, you know, as someone has mentioned, it is clear, but there's not always clarity. And I don't expect our staff to always have the policies memorized in front of them, but just specifically when we talk about when students are 6 feet apart, especially on playgrounds and things like that, when they are under strenuous physical activity, which is written into our policy, that those times that we just reiterate with our staff that they should not be, we just need to be following the policy and not going beyond that.
I think that's a great recognition, Ms. Campbell, as we start to see warmer weather, and I'm getting a head nod from Dr. Mullins that he will take care of that.
I'll make sure that our administrators receive the clarification by Monday.
Super. Thank you, Dr. Mullins. Mr. Susan?
There's just a time-sensitive thing for competitive cheer, so if we could put it on the agenda for Tuesday as a board discussion, just to see if there's opportunity, because of the Florida High School Athletic Association is asking us for a deadline to, if we are going to engage in doing competitive cheer, that it would have to be in pretty soon. So just a discussion point for Tuesday. We don't need to discuss it now. And if it gets resolved before then we can pull it off.
Ms. Escobar, would you please add competitive cheer competition as a discussion point on Tuesday's agenda? And Mr. Susan, would you please make sure that the board is briefed on the issue prior to?
Sure.
So we're
Absolutely.
prepared.
Yep.
Any additional discussion today? Hearing no further business, this meeting is adjourned.